Hello, everyone, and welcome to this audio podcast. This audio podcast is part of the Bostix Titus issue, audio podcast as part of analytical storm. Uh, welcome, welcome to, and also and in this audio podcast, I'd like to the Giant Storm and another Storm Robotics production. This audio podcast, as part of this audio podcast, there'll be in this audio podcast a bit of intro. So tech has allowed patients with varying or different conditions, different conditions to access supplementary information regarding to health and disease, including through, for example, the National Health Service or NHS, through NHS websites, and portals sort of websites and portals, but also through sort of patient-based organizations, and various other sort of and various other sort of modalities. The current concern, or one of the sort of main sort of concerns, has been that despite tech advances, integration between information searching versus knowledge implementation differs between age groups and across varying health and long-term conditions. And Although in the original paper, or peer-reviewed peer-reviewed manuscript, if you like, although the authors had not highlighted, had not delved into sort of into and in around sort of learning disabilities, and in around learning disabilities, the the basis is as thus similar. So information available over the internet, for example, is generally vast, and much of it can be daunting and lead to misinformation, and the basics for patients the basics for patients with long-term conditions still require attention, still require attention, and this is pertinent. So support for patients suffering with particular diseases from professionals can be multifaceted, and therefore where patients would normally see more than one healthcare professional, for example, for an aspect of care, patients would perhaps find it advantageous to schedule appointments with those from health professionals. From those professionals who are trained in to and in areas of healthcare or healthcare practices to provide a sort of a remote education service. And so, for example, patients on varying varying sort of medications, and where healthcare requires varying lab tests and investigations, varying lab tests and investigations, for example, might find it advantageous to have reviews online, And similarly, patients with particular conditions or specific conditions. So again, in this peer review works, collaborators have used a chronic kidney disease basis, and might find it more pertinent to communicate and gain baseline education in around blood tests and investigations. And so initiative would be supplementary to care documents that already exist, and as part of, for example, electronic patient records or EPRs. And of course, any health education provided would also require documenting and transfer of information and connectivity of any future or prospective technologies or links between electronic patient records and knowledge. A knowledge provision would need to be fast, reliable, and at the same time GDPR compliant. So thank you for tuning in on this audio in this audio podcast, and this audio podcast as part of the Bostix Titus issue. This is an audio podcast as part of an analytical storm, an audio podcast as part of the SZtorm, and an audio podcast as part of another Storm Robotics production. Thank you.